Hi guys, today we will be talking about COPD, but before we can get into something as elaborate as that, let's give you some background info that may help you with understanding what COPD is. Breathing is an important process that allows our body to perform basic functions such as eating or moving. Breathing, or what we refer to as respiration, allows us to exchange gases with our environment. We breathe for about 8 to 16 breaths per minute. During respiration, we breathe in or inhale oxygen and release or exhale carbon dioxide, which are the two main gases involved in respiration. Oxygen is a vital gas because our human body simply cannot function without it. Almost every tissue or organ in our body needs oxygen to perform its function. An organ is a group of tissues that perform a similar function, while a tissue is a group of similar cells. Cells are the basic structural and functional unit of life, and they require oxygen to make energy and stay alive. The main organs that carry out the process of respiration are the lungs. First, oxygen enters our lungs when we inhale through the nose and mouth, and then goes through the trachea. Next, it enters the bronchi, which are the tubes or passageways that enter the lungs and lead in particular to the alveoli, which are the little sac-like structures where the exchange of oxygen and carbon dioxide take place. So we would imagine a serious damage to the lungs could be fatal, as it would affect our breathing and eventually our cells in our body, making them unable to do their job. COPD, or Chronic Obstructive Pulmonary Disease, is a group of serious lung diseases that block airflow in the lungs, making it difficult to breathe. The most common conditions of COPD are chronic bronchitis and emphysema. Chronic bronchitis is characterized by an inflammation and narrowing of the airways in the lungs called the bronchi that may cause mucus to build up in those passageways. Emphysema is characterized by a damage that occurs in the air sacs of the lungs, known as the alveoli, where the gas exchange process occurs. Both conditions damage the lungs and hinder the process of respiration. The major cause of COPD, making it very common amongst people, is smoking. Smoking brings in harmful chemicals into the body that affect the lungs in a variety of ways. They may weaken the immune system in our lungs against pathogens or infectious particles that can cause swelling in the air tubes and destroy the air sacs, which all contribute to developing COPD. The immune system defenses are critical in the lungs because as we inhale oxygen from the outside environment, other particles such as dust and pollen may enter alongside oxygen that we do not want, as they may harm our body. In this case, the role of the immune cells in the lungs is to fight those foreign substances. Other factors may contribute to developing COPD, such as being exposed to certain harmful chemicals or gases, long-term exposure to air pollution, family history of COPD, and other respiratory diseases may increase the risk. Individuals with COPD may experience a range of symptoms that include shortness of breath, wheezing, a frequent cough that may produce phlegm, tightness in chest, and swelling in the legs. If symptoms begin to appear, a doctor visit is recommended as soon as possible. The doctor would ask you about your symptoms and if you have any history of smoking. Next, they would perform a physical exam to check your overall well-being. The doctor may measure what is known as vital signs, which include your temperature, blood pressure, and heart rate. They are vital because often abnormal measurements may indicate a problem or condition in the body. To take a better look at your lungs, the doctor may order an X-ray for your chest. X-rays would give a better image of the lungs inside your body, and if there is anything not normal, it would appear in the X-rays. Another efficient way to diagnose COPD is ordering a spirometry test. A spirometry test is a breathing test that measures how much air you can breathe in and out of your lungs, as well as how fast you breathe. COPD is considered one of the leading causes of death in the United States, with around 16 million Americans being affected with the disease. It is a serious lung disease that, if not treated properly, it will worsen over time and may lead to many other serious complications. People with COPD may develop another lung condition, such as pneumonia. Pneumonia is when the air sacs in the lungs become inflamed and filled with fluid as a result of an infection, which again impairs the process of respiration. COPD is also a major risk for developing lung cancer. The lung cells in individuals with COPD have already been damaged due to the multiple harmful chemicals that they have been exposed to, which have already caused their COPD, and over time this damage may lead to cancer. Lung cancer occurs when cells in the lungs eventually begin to behave abnormally as a result of the severe damage that has accumulated, and they begin to divide without control, leading to massive cells known as a tumor that spreads and damages the tissues or organs, in this case the lungs. While there is no cure for COPD, it can certainly be treated to relieve symptoms and prevent further damage to the lungs. There are many different ways to treat COPD, but a common one is oxygen therapy. Oxygen therapy provides you with extra amounts of oxygen, either through a mask or a nose tube, that will make you breathe better. When none of these treatments work, and in the case of severe lung damage, a surgery may be required. During the surgery, a surgeon may remove the irregular air sacs from the lungs or the severely damaged lung tissue. A lung transplantation may also be an option if the patient's own lungs cannot function anymore, and hence are replaced by healthy lungs from a donor. Before any of these extreme measures are taken though, the first thing your doctor would ask you to do is to quit smoking. Smoking is a major concern here, and while medication can be given to ease symptoms, if the patient does not quit smoking, damage to the cells in the lungs will continue to make medication almost ineffective once there has been so much damage. Among the medications that can be prescribed are bronchodilators, which widen and help relax the airways, bronchi, making breathing easier. Those are usually given in the form of an inhaler. To avoid all these complications, be smart and don't start.